Hey everyone, and welcome back to my channel. Today, we're diving into a topic that's near and dear to many women: pregnancy and skin changes. Now, we all know about that pregnancy glow, right? But sometimes, pregnancy can bring about a few unexpected surprises on our skin. Don't worry though, I'm here to tell you that most of these changes are completely normal and tend to fade away postpartum. But, just like any good dermatologist would, I want to equip you with all the information you need to have a happy, healthy, and comfortable pregnancy journey. So, whether you're expecting your first little bundle of joy or you're a seasoned pro at this whole motherhood thing, stick around as we break down the most common skin conditions you might encounter during pregnancy, and more importantly, what you can do about them. Let's get started. Let's start with a super common one. Melasma, often called the pregnancy mask. Picture this. You're expecting hormones are surging and suddenly you notice darker patches of skin popping up on your face. That, my friends, is melasma. Those pesky hormones, estrogen and progesterone, are often the culprits behind this hyperpigmentation. And while it usually shows up on the forehead, cheeks, and upper lip, it can actually appear anywhere on the body. But don't fret. Melasma is generally harmless and tends to fade after delivery or once you've finished breastfeeding. Now, the million-dollar question: how do you deal with it? Sunscreen, sunscreen, sunscreen. And I'm talking SPF 50 or higher every single day, rain or shine. Trust me, protecting your skin from the sun is your best defense against melasma. Along with that, stick to a gentle skincare routine and avoid harsh scrubs or treatments that could irritate your skin. Next up, we're tackling those little souvenirs of pregnancy stretch marks, also known as striae gravidarum. These pinkish, reddish, or even purplish streaks often appear on the belly, thighs, breasts, and sometimes even the upper arms as your body expands to accommodate your growing little one. Now, stretch marks happen when the skin stretches rapidly, causing those elastic fibers in the dermis, the middle layer of your skin, to break down. Think of it like blowing up a balloon too quickly. And while they might look a bit dramatic at first, trust me, they fade over time and become much less noticeable. So can you prevent them entirely? Well, not always. Genetics play a role, but keeping your skin well hydrated and moisturized can definitely help minimize their appearance. Look for creams or oils specifically designed for pregnancy, and remember, consistency is key. Chapter 3. PUP, Rash, Decoding the Itch. Now, let's talk about something called PUP, which stands for pruritic urticarial papules and plaques of pregnancy. Don't let the long name scare you. PUP typically shows up as itchy red bumps, often on the abdomen, and it usually pops up in the third trimester. We're still not 100% sure what causes it, but it's thought to be related to the stretching of the skin, and thankfully, it's usually harmless to both mom and baby. It tends to clear up a few weeks after delivery. The biggest challenge with PUP is that unbearable itch. But don't worry, there are ways to find relief. Cool compresses, oatmeal baths, and topical calamine lotion can work wonders. And of course, if those home remedies aren't cutting it, your dermatologist can prescribe stronger creams or antihistamines to help you manage the itch. Chapter 4. Pemphigoid gestationis. When to seek immediate help. Okay, now it's time to get a little more serious for a moment and discuss a less common but potentially more concerning condition called pemphigoid gestationis. This is a rare autoimmune disorder that affects the skin during pregnancy. Pemphigoid gestationis typically starts as itchy red patches that develop into blisters. And while it usually shows up on the abdomen, it can also appear on the arms, legs, and even the palms of your hands. Here's the thing about pemphigoid gestationis. It needs immediate medical attention. So if you notice any unusual rashes or blisters during your pregnancy, please don't hesitate to contact your doctor or dermatologist right away. Early diagnosis and treatment are key to managing this condition. Chapter 5. ICP. It's more than just itchy palms. Last but not least, let's talk about a condition called intrahepatic cholestasis of pregnancy, or ICP. This one is super important because it's not just a skin issue. It affects the liver. The hallmark symptom of ICP is intense itching, especially on the palms of the hands and soles of the feet. Now, this itching is no joke. It can be severe and incredibly bothersome, often worse at night. Here's why it's crucial to catch ICP early. It can pose risks to the baby. So if you're experiencing intense itching, especially on your hands and feet, please reach out to your healthcare provider immediately. They can run blood tests to diagnose ICP and discuss the best course of action to ensure a safe and healthy pregnancy. Outgrow Glowing Mama, your guide to healthy pregnancy skin. So there you have it, your crash course on some of the most common skin changes during pregnancy. Remember, your body is going through a lot during this incredible time, and those hormonal shifts can definitely show up on your skin. But here's the good news. Most of these skin changes are temporary and tend to fade after delivery. In the meantime, focus on keeping your skin clean, moisturized, and protected from the sun. And don't be afraid to reach out to your doctor or dermatologist if you have any concerns or if something just doesn't feel right. Pregnancy is such a special and transformative journey. Embrace the changes, take care of yourself, and know that you're not alone on this wild and wonderful ride. Thanks for watching.